Just how excited should we be about this latest data? Joining me to discuss is Dr. Carlos Del Rio. He's Executive Associate Dean at Emory University School of Medicine. And Dr. Jeremy Faust is emergency physician at Brigham and Women's Hospital in Boston and an instructor at Harvard Medical School. Welcome to both of you. Dr. Del Rio, I'll start with you. And in some ways, I thought it was interesting that the Regeneron news about these treatments and how useful that could be in preventing the spread of COVID, especially, if you're someone who is in contact with somebody who has COVID, if you're waiting for the vaccine to come out, even if that kind of 3 or 4 weeks between the first and second vaccine doses next year is too long for you to wait. The CEO this morning was suggesting that Regeneron could really play an important role in the spread of COVID here. What do you think?
I think that's right. I think that potentially we can use this monoclonal antibodies as we used to use in the past hyperimmune globulin for hepatitis. It's a way to give you a post-exposure prophylaxis. If you've been exposed to somebody and you haven't received a vaccine, you could get a dose of immunoglobulin. In this case, we have monoclonal antibodies that they will prevent you from getting the disease. It does a little bit of what a vaccine does, except those monoclonal antibodies don't last that long. The problem is we simply don't have enough of them. And I think the issue is going to be simply scaling up and having enough supply. So I'm not sure this is going to make a significant impact in the pandemic the way the pandemic is right now in the U.S. We have too many cases. I mean, with 200,000 new infections per day, we simply are not producing enough monoclonal antibodies to even treat a third of those people.
And Dr. Faust, on that note, there's a lot of questions about who gets which vaccines and who gets them when. What do you know at this point about the rollout?
First of all, I think it's an incredibly important moment to say this is why we do the science. If we had not done a really good trial, or if they had not done a good trial here, we never would have known this difference between the 62% and the 90%. Think about what a huge difference it makes to know that. This surprising finding that the different dosing strategies, think of the number of lives saved by not rushing. So I want to really underscore that point. To your question, there is a diversification happening here. We have multiple products coming out, and what I'd like to see happen is a match between the strengths of one product and the needs in the regional needs of a population. So, for example, as I think that Meg said, you have a vaccine that might be less effective today, but that's great if you can have it tomorrow. But if you have a 95% effective vaccine, it's not really useful if you can't get it until next year. So what I think we're going to look at here is a match between what a product offers in terms of its efficacy and also its practicality. And we also need to learn more in terms of the tail. So it could be that one vaccine has 95% effectiveness, but we learn that it has a shorter protection window. We'll see. So I think in the next few months, we're going to learn a lot about this. And then the key will be, can we actually coordinate this, or will rollout be kind of chaotic? There's a possibility there. So we need the bright people in the room to kind of make these calls.
Shepard Smith here. Thanks for watching CNBC on YouTube.